and percussion. For percussion specifically, I'm going to explain only about the mass, because the rest of the thing you know, right? Because everyone already explained the liver, everything. Just for the mass, you need to percuss towards, let's say the mass is here. You're going to percuss starting from up towards the mass, not from the mass and then you go up, find the border. No, from up then you go down. Okay, this is actually you want to estimate the border of the mass lah. That is for percussion. So as for conclusion, when you do all the general examination, okay, let's say I'm going to present the case to my specialist. On general examination, for example, Puan Sarah, middle-aged lady, is lying on the flat comfortably. She is conscious and responds. During that, you ask, you introduce already, you ask for permission already. So you know that she is responsive to your conversation. So she is conscious, responds to conversation well. She is not on respiratory distress, and her respiratory rate is, let's say, 18. Okay. I can see granula on the right hand with 1 pint of normal saline. Okay. As we do everything, you do the palpation. So I would like to continue with the palpation on the abdomen. So you see, I usually expose the patient starting from the nipple line up to the mid-thigh. However, today I'm going to expose only from the bra line up to the suprapubic area. Okay, so you continue with the inspection. Okay, on inspection, let's say there's a mass. I can see the abdomen is distended. It moves with each of the expiration and inspiration. The umbilicus is centrally located, meaning the mass is not that big. So the umbilicus is still at the normal position and inverted. There is a low abdominal scar, well healing with no keloid. There was no cutaneous sign of pregnancy, no skin hyperpigmentation, no dilated vein, and no visible peristalsis. Cough reflex is negative. That is when you do the inspection lah. So I'm going to further my examination with the superficial palpation. So you do everything. Abdomen is soft and non-tender. On deep palpation, you do the deep palpation. I can appreciate a mass at right lower quadrant. That is the first criteria. The site of the mass, at the right lower quadrant. So with measure about 15 cm to 10 cm. That is the second criteria, the size. And then single mass. Okay, and then what is the consistency? Whether it's firm or cystic or hard or soft. Okay, and then the next criteria is surface and margin. So as after the firm consistency, surface is smooth, the edge is well defined, it is mobile up and down. When you palpate, you can feel that the mass is moving up and down, side to side, or maybe it's restricted, meaning you palpate, it doesn't move at all. Okay, and then that is when, the next one is whether you can get below the mass or not. So it's mobile up and down, and also sideways direction. I can get below the mass and above the mass. So and then there is no hepatosplenomegaly. Scar is non-tender and no ascites. That is the 8 and 9 criteria, presence of ascites or not, and then presence of organomegaly. Okay, and then percussion, note is resonant and there is no shifting dullness. And the next one is on auscultation, vowel sound is heard and normal. There is no bruit over the mass. So that is how you present the case whenever you see the patient is having any mass in the abdomen. So, as I present this case, what do you think? What kind of mass you see in the patient?
Ovarian.
Yes, ovarian mass. Why? Let's say that the specialist asked why. Because
Go up and down.
Go up and down because of the location in the right lower quadrant. and because you cannot get below the mass.
Can you
Cannot
get?
Can get below.
Can get below the mass. Sorry, can get below the mass. So there is three things. So and bear in mind, whenever you suspect it's ovarian mass, bear in mind that you have to know the deep diagnosis for this ovarian mass also. When any cases, any department, whenever you suspect any disease, you should have at least 2 deep diagnoses. So for this one, let's say the deep diagnosis is pedunculated uterine fibroid, or maybe appendicular mass, or maybe bladder or kidney. Okay. And then, how do you know that the mass is not originate from the skin, muscle, bladder, or retroperitoneum?
Garang.
Okay, let's say from the skin, I pinch the mass, and I cannot. I pinch the skin. I cannot feel that the mass is going together with the skin. That is why the mass is not originate from the skin. The muscle. I ask the patient, please contract your abdominal muscle, and then I feel that the mass is still the same shape as I palpate before. Meaning the mass doesn't come from the muscle. And then the bladder. When I palpate the mass, patient doesn't feel the urge to pass urine. Meaning it's not coming from the bladder. And the retroperitoneum, why? Because normally if the mass coming from the retroperitoneum, it is restricted and fixed to retroperitoneum. Okay. Okay? So how do you know the patient is not pregnant?
No signs of.
No cutaneous signs. When you palpate, you cannot feel any fetal part, and then there's no sign of and symptoms of pregnancy. Okay? That is how you present the gynae case, normally mass lah. Okay? And then after you finish, then you continue with pelvic examination, the specular, the manual, bimanual. Okay? So I'm going to start with position and exposure of the patient. Okay, as for this one, the pelvic examination, you ask the patient, the position of the patient, it should be this part slightly raised around 10 to 15 degree, like slightly raised lah, kan dia punya table ni boleh naik kan. Okay, and then the leg is abduct, and then this the feet should be on stirrup, like in gynae table. Litotomy position. And then the buttock should be at the end of the table, edge of the table. Okay. Okay, so the position, takkan you nak expose from up kan, so you gonna expose from down. Okay? Okay. So before you start, okay, let's say lah like this. So you already cover the patient with drape, then you open the drape, and then you inspect. First you inspect, okay lah. So you inspect the vulva area. Okay? Vulva area, starting from the mons pubis, the hair distribution, whether it's too excessive or not, and then the labia minora, labia majora, labia minora, where normally the vulva ulcer happen. Okay, so you need to inspect inside. So perianal area presence. This is a perianal area or foreshape. To check for any tear, and then the anus, vagina, the entrance of vagina, urethral opening, and clitoris. So for this one, normally when you inspect this one, the normal common finding is lumps, excoriation, lesion, rashes, mass, any leukoplakia, lichenification, or any laceration. Okay? Ni. This is